Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. An interesting study suggests that exercise can boost survival rates in people who have colon cancer. Here to help us understand this research is exercise physiologist Dr. Carol Sames. She's an associate professor of physical therapy education and an assistant professor of physician assistant studies at Upstate. Welcome back to The Informed Patient, Dr. Sames.
Thanks so much, Amber. I'm glad to be here.
This was an international study published in the New England Journal of Medicine, conducted in Canada, Australia, the United Kingdom, Israel, and the United States, so people from a wide variety of countries. How can the researchers make the claim that exercise improves survival in colon cancer?
Well, their study was really well controlled. They had 889 individuals, as you mentioned, from a variety of areas, and they were assigned to either a 3-year structured exercise group that had some behavioral support or a health education group after they had had surgery and completed chemotherapy for their colon cancer. And then after 3 years, the structured exercise group with the behavioral support had a significantly longer disease-free survival and longer overall survival than the non-exercise group.
Interesting. So they just put them in the two groups and compared one group against the other.
Right. But they were very specific with these groups, and this is what makes this study so strong. They had very specific criteria for the stage of colon cancer. They needed to have finished chemotherapy in the past 2 to 6 months before. They needed to be exercising under 150 minutes a week of moderate to vigorous intensity, cardiovascular or aerobic activity. And that's important because the guidelines are 150 minutes or more. So they had to be under that. They also took a number of different tests, like a treadmill walking test. They had to have a specific score on a disability index. They also were specific about the countries that they were from, so that if there was somebody from Canada who was in the exercise group, there was somebody from Canada who wasn't in the exercise group. They, again, were very specific. They made sure that the groups were fairly homogeneous in number of males and females, in age, and body composition. So they were very specific. And that's really one of the strengths of this particular study.
So all of what you just described, is that why they can draw a connection between cause and effect?
So because it was a randomized controlled trial, that's just a stronger type of research. In the past, a lot of the cancer studies have been what we call a cohort, meaning we start following people over time, and then you look back and see who was in the exercise group and who wasn't. And those groups could be different from the start. But these investigators were intentional in terms of making sure that the groups were similar. And that's really important. Plus, it was randomized, which means if I wanted to be in the exercise group, I couldn't just say I'm going to be in it. There's a computer that generates numbers, and so it randomizes to the exercise group or the non-exercise group.
This study went on for 8 years. Those in the exercise group had 28% fewer cancers and 37% fewer deaths from any cause. Do results like this surprise you?
Well, considering that I'm an exercise physiologist, I would kind of say no, because we've known for years that exercise impact on primary and secondary prevention for cardiovascular disease and heart disease is very strong. We know that there's even a reduction in risk for all-cause premature mortality, hypertension, stroke, osteoporosis, reduces the risk for type 2 diabetes, metabolic syndrome, osteoporosis. So we kind of have this gathering evidence, and so I think it just does a good job of supporting that. And also I think recognizing that this intervention, again, I mentioned it was intentional. They were very specific. I think what made these investigators um, smart, so to speak, was that the exercise intervention also included this behavioral support, because we know that you need to have an understanding of what to do. The individuals met with a coach. In the beginning, they were meeting, actually, the behavioral was every other week, but they were exercising every week, and they had a coach, they had a support system. And then they started to taper that off for the exercise group, gave them a little bit more freedom. They could meet online as opposed to in person, but they still had that coach up to 3 years. And I think that also illuminates the fact that, behavioral change is hard, and that when you have a support structure, um, it can increase the chances of success.
Do we know the actual mechanism for how exercise is tied to cancer prevention or colon cancer prevention or recurrence?
So, yeah, that's a great question, and we know that exercise reduces chronic inflammation, and that term is always tossed around. But the reason chronic inflammation is so bad is that it affects all body systems. There are times when we might have an acute stressor, like I'm trying to cross the road, and all of a sudden there's a car coming, and I have a shot of adrenaline, and I quickly get across the road. But it's that chronic inflammation, that chronic stress that causes damage throughout the body. We also know that exercise can reduce estrogen and growth factors, which can impact specifically breast and colon cancer. Also, exercise can bring down levels of insulin, which also can help with certain forms of cancer. It improves immune function, or our ability, to fight off all of those viruses, bacteria that exist in the world. Being active can reduce the incidence of obesity. And with obesity, our fat cells can actually produce hormones that can either stimulate or inhibit cell growth. And we can stimulate mutant cells, and that's how cancer can grow. So there are a lot of mechanisms. In this particular study, they did collect blood samples. And so I suspect that this group of investigators will be reporting on that data in the near future.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with exercise physiologist Carol Sames about an interesting study in the New England Journal of Medicine that looks at how exercise can improve survival rates for people who had colon cancer. Now, if this type of exercise program with the coaching can be so effective, do you think it's something that health insurers might start paying for?
Well, it certainly would be wonderful. We know that insurance will pay for cardiac and pulmonary rehab with specific diagnoses. Um, the United States isn't quite on board with the idea of prevention. We tend to like to fix things. But as this data keeps becoming stronger and we start to see this expanding to other cancers, I just hope that there can be programs, because ultimately it's not just about money, it's about a person's quality of life. I mean, if we can increase length of quality life or reoccurrence of cancer, I mean, that has so many positive implications. And if we're talking about insurance, insurance is going to want to see that it's a cost saving. And it really is. And so I'm hopeful that, in the near future, we'll see exercise really as a treatment and a use for many chronic conditions.
Well, if this has been shown to be effective for colon cancer, do you think there'll be other similar studies that are designed to look at other types of cancer?
Absolutely. In fact, breast cancer, bladder, and endometrial have very moderate to strong evidence that exercise is beneficial in terms of quality of length of life and reducing reoccurrence. There's a significant risk reduction in ovarian, esophageal, liver, stomach, kidney cancer, and myeloid leukemia. And then there's also some evidence that's growing stronger with a decreased risk for multiple myeloma, as well as cancers of head, neck, rectum, bladder, and lung. So the data is coming, and I mentioned we have stronger, and then we can have moderate evidence, and it's just a matter of studies like this that are really well controlled, that are randomized controlled trials, that are fairly large sample size. This is all in the pipeline. We're going to see more of this research coming out.
Does any of it compare people who were exercise people already with people who would be new to exercise? Is the benefit the same?
So in this particular study, the individuals had to be under that 150 minutes a week of activity in order to be considered for the study. So when we look at people that are already exercising, that's some of that cohort research I was talking about. You can't have a randomized controlled trial where you tell people you can't exercise. And so a lot of the research that's been out has been a cohort study. So we could have a group of individuals, find who has a particular type of cancer, and then go back in time and figure out, like, have they been exercising, asking questionnaires, giving them questionnaires to fill out. And that data isn't as robust because, as humans, we're not great. We're not really great at remembering like what we do. Or sometimes when we fill out questionnaires, we're not always honest, like, oh yeah, I exercise all the time. So this particular study, they had track of what people were doing. They had the coaches. They had a lot of follow with the group that wasn't in the exercise intervention. And that's just what made this study so strong. So I'm pretty positive that we'll see this replicated in some of these other cancers.
For people who are listening who have recovered from colon cancer or another cancer, what sorts of exercises might be good? I mean, what are we talking about when we talk about exercise?
In this particular study, they were walking for the most part. And if there's any negative about this study, it's that they only did aerobic or cardiovascular activity. So the majority of people walked, which is fantastic, but it could be anything. If you like to bike, if you like to swim, it doesn't have to be walking. It's just, a lot of people, it's easily accessible, doesn't need a whole lot of, you just need a place to walk. And most of us tend to walk. And so they did use walking. But what they didn't include in this study was resistance training. And we know more and more about the benefits of resistance training, especially in older adults. And these particular individuals, their median age when they started the study was 61 years old. So clearly, if they had been followed for 8 years, they would have been past the age of 65, which we consider an older adult. Strength training is so important as we get older. It's more important as we get older than when we're younger because we lose muscle mass. Sarcopenia is a condition that causes us to lose muscle mass as we get older, and you need muscle to move. So it would have been really great in this study if they would have included resistance training because it's so important for function, reduce risk of falls. But I know in the future, that's what they're going to start to see is these will be combined, both aerobic or cardiovascular exercise with resistance training.
Well, are there any risks or downsides to becoming active after you've survived cancer?
Just like anything, if I've been inactive for a long period of time for whatever reason, when you start to move, if I've been inactive, my muscles are not going to be as strong. I probably am not going to be as flexible because I haven't been moving as much. And so, yes, when you look at soreness is a big one that people will say, oh, I am incredibly sore. The nice thing about soreness is that's going to go away as I continue to be active. Soreness it could just be the fact that that muscle hasn't been used in a while. And so my tissue tolerance is low to start with. Some people can have some strains and, there's ligaments involved, tendons, but that should go away with time. The key is to not try to be a hero in the first week, to make sure that you're warming up, that I probably should be doing some type of stretching of major muscle groups, and I slowly increase my intensity. I don't try to go from 0 to hero in a week. That certainly will have a much higher risk of all of that musculoskeletal soreness.
Well, this is really good information. I appreciate you making time to share it, Dr. Sames.
Thank you so much. It was a pleasure to be here.
My guest has been Dr. Carol Sames, an exercise physiologist who teaches in physical therapy education and physician assistant studies at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.